I think the number one thing you have to select your doctor, you know what it is? Trust. You have to trust your doctor. Because I can tell you, a doctor is still, working, using the knowledge combined with the critical thinking and merge that together, right? So you take the data, the lab and the intervention or market, merging that together, and you say, is that going to work for Israel?
I'm Dr. Esra Çavuşoğlu, and I've been living a sober life for the past 18 years. My battle with addiction drove me to seek new methods, devices, and supplements to improve my physical and mental performance, enhance my quality of life, and ultimately live healthier for longer. From my experiences in addiction recovery, biohacking, and longevity to the latest global developments, from groundbreaking entrepreneurs to expert academics, the conversations I've had over the years are now featured weekly on Soberhead Podcast. Welcome to Soberhead Podcast. This week, we have a truly groundbreaking guest, Dr. David Liu. With over 25 years at the forefront of longevity medicine, Dr. Liu is a pediatric cardiac surgeon, entrepreneur, and a philanthropist who is shaping the future of health span optimization. From pioneering AI-driven solutions to lead the world's most elite physician network, Longevity Docs, is empowering doctors, corporation, and high-performing individuals to thrive in the longevity era. In today's conversation, we'll dive into Dr. Liu's innovative work to make longevity medicine accessible, scalable, and evidence-based, as well as the groundbreaking research that's shaping the way we approach health and aging. Stay tuned for an inspiring discussion that could revolutionize how we live longer, healthier lives. Our host for this episode is DotsUp, the space, community, and platform where creatives, experts, and entrepreneurs come together at the meeting point of continents, the Bosphorus. Follow the link in the show notes for more information about events and membership. I'd like to thank Gedik University and Gedik Foundation for their trust in Soberhead Podcast. With their support, it is possible for us to bring you this content at this quality for absolutely free. And of course, every single one who has subscribed to this channel. However, a huge amount of people who watch Soberhead frequently are not subscribed. So, I will ask you for a quick favor. Hit that subscribe button now, because when you subscribe, it helps us make the show better and provides better access to the world-leading experts. Subscribe and share if you like. And I promise to continue to bring you a better Soberhead every day. Welcome to Soberhead Podcast, Dr. David Liu. I'm super excited of your appearance.
Thank you so much. No, I'm so excited to join you. I love the production of the podcast. The guests are amazing. So thank you for inviting me. It's a privilege.
So, you're a French-born pediatric cardiac surgeon. Interestingly, only very short time ago, a couple of years ago, you positioned an organization that, people were talking about longevity, what a hype. You positioned the organization as longevity medicine starts here. So, in one sentence, what is longevity medicine and what's different from just living healthy or from functional medicine or from regenerative medicine?
Yeah, look, I think that's an amazing question. And in the humble response is, I don't think we have a proper definition, but this is mine. I think longevity medicine is just good medicine, right? Every doctor should be a longevity doctor. But because if you look at it, when you start medical school, we tell you, hey, what's your goal, right? The goal is to not only treat the disease, but you want to maintain people healthy as long as possible. And so what I realized, especially during my early careers, is we were treating disease the same way all the time, right? You have a heart attack, you have a congenital disease. What do? As a surgeon, we have to open the heart, fix it, close, and then obviously we expand the number of years you can live with a fixed heart. But what I realized as well from my dad's background was a Chinese physician, Chinese medicine expert, and acupuncture in France. I learned that prevention was as well a way to look at maintaining health and obviously providing good care. And so I think right now, if I want to give really a more practical definition, if you combine preventative medicine, right? Looking at different biomarkers, different symptoms before the disease appear. If you look at functional medicine, where you have to look at the root cause of disease, not understanding only where the disease appear, but why, right? And if you look at even regenerative medicine, where you're trying to reverse a state of health or disease to a prior state, I think it's a combination of all of it, right? But what I realized as well, what happened in the past few years is you had access to so many different technology, right? Those technology are coming from wearables, different type of testing, different type of data, and obviously not only they are growing, they're getting more accessible and cheaper. And so I think we are adding a new type of medicine. I would call it technology medicine, right? You have all those information, all those data coming to not only the patient, but as well to the doctor. And so how do you combine all those different type of trends and I would say training under one roof? And I think longevity medicine must have one clear goal, right? Is not only to extend the number of years you're going to live, which is the lifespan, but the number of years we're going to keep you healthy without eventually a disease, which is health span. And both of them are highly discorrelated. So what I think it's a new type of medicine that combine not only the prevention, that use the data to apply and to work on the root cause, but as well can focus on the new technology and the cutting edge approaches to even, if we can, stop aging, and why not eventually in the future reverse it with data and science. So that's what I think is going to be the future. Medicine is traditional. Usually they focus on the disease. They treat it really well. If you have a cancer, heart attack, a stroke, longevity medicine is not probably dedicated to those type of disease. However, when you don't have anything and you want to make sure you prevent them, right? Or you reverse this period where in between you still have the evolution, let's say in a heart attack, right? You have the plaque that start building in the coronary artery. Can you stop that? Can you even reverse it, right? Just to make sure you don't reach the point where you're going to suffer from a heart attack. I think that's going to be amazing to see where the future leads us with this type of new medicine. It's still early age, so we have to be humble and understand that we're still really early in this new industry.
I'm sure there was just this one moment that you suddenly decided. Do you have a nonprofit organization that you do some work in Africa? Am I correct?
Yeah, totally. Yes.
And so you're a philanthropist. You're kind of, when I spoke with Dr. Elizabeth Yurt, she portrayed you as he's a politician. So I think that you're creating good relationship between, investors, creators, countries, governments, etc. So you need to be very political in a way. But what made you suddenly what made you, I'm not even sure if you stopped doing surgery on children, but what was the moment that you decided this is missing in the field and then I have to build this?
So I think, life is really interesting, is always a journey, right? And so sometimes you connect the dots, like Steve Jobs said, looking, backwards, right? And so what was really exciting is you never know where you go, right? You just pick your specialty because you like it. So to be honest, I wanted to be a plastic surgeon to begin with. So I started to do my training in LA, and all of a sudden I look at the room. There was an OR at US County Hospital, and I see a guy putting a valve in the heart, right? Like an aortic valve with, and I see this orchestra. I'm like, wow, that's the most magical moment, and I still remember like it was yesterday. And so obviously, I decided to become a cardiac surgeon, and then a pediatric cardiac surgeon. So I trained in Paris in the two main institutions in pediatric cardiac surgery in France, in Europe, even maybe in the world. And what I realized, especially really young, is that no one has really access to this cardiac surgery everywhere in the world, right? You had to be in a really highly specialized hospital. So when I was age 21, before even I became a surgeon, I created an organization. I was totally nonprofit, and we were going with a group of young doctors, residents, and sometimes even professors to a developing nation to operate people. So it was children with malformation. It was orthopedic malformation. It was, neural malformation, and then it became the heart. But I think the moment, there is a moment in time, where sometimes you click. And this moment was in Mauritania in 2000, I think, 13. We were out of the OR. We were operating kids during a mission. And someone said, you have to see this little girl. Her name was Miriam. And I said, okay, perfect. Let's go and see her. Where is she? She's in the waiting room outside. I said, no. You have to get into a cab. We're going to go and see her. So get into a cab. You know what? I was thinking, it's 2 minutes away. We drove for an hour, right, in the desert in Mauritania, Northern Africa. And it's like, wow, where are we going? Totally unknown. And so we met this girl. She had, an advanced cardiac disease. I still see the X-ray that I was holding in my hand. And in this moment, I clicked and I said, imagine if we had come earlier, if we had the tools to check her heart earlier, or she had a way to talk to a physician or a practitioner to describe the symptoms. We could have probably saved her and avoid those complications. And so then I started to see, if I take the cab to go to see Miriam, right, in the village with my stethoscope, can we send another doctor with a more advanced technology? And so we started building mobile clinic, right, to go and screen children in villages in Africa where obviously they didn't have access not only to a cardiologist, but not even a heart surgeon or hospital. And so therefore, at that time, which is like 11 years ago, I realized it was exactly the same problem in the US. People were coming too late with the disease. And it was not a congenital disease, but it was, lifestyle disease, cardiovascular disease that could be avoided at 99% of the time, due to an healthy lifestyle. And so therefore, I started to really understand the system was only built to solve the problem, right? Not to avoid the problem. And so if we think about, wouldn't that be better if we didn't have the problem in the first place? We don't have to fix it, right? And to do that, you have to rethink the whole way of looking at the care delivery. And so, I appreciate what Betsy, Elizabeth, you were saying. I am not a politician. I don't make any promise, right? And I don't have any economical agenda. But you have to use, diplomacy. You have to understand that everything is an ecosystem. And if you work in silo, right? If you don't understand that everything is fragmented, and if you don't want to connect the dots with other within the ecosystem, it is really hard to change the game. And so I learned that. I learned that really early when I was 20, navigating different countries. That you have to have the Ministry of Health involved, but you have to have nurses in the field. You have to have the parents, the school teacher, the hospital, the device manufacturer, right? The drivers. And so I think it's building this whole ecosystem of people for the Heart Fund, the foundation I created with my other colleagues, that I realized that you have to bring a whole village to change the whole game. And so that's what, I think I understood that being a heart surgeon was only a piece, right, of the puzzle, right? You are fixing a heart in a punctual time. But as a physician, I had, a larger vision, which was, can we improve the system? And the system should be led by physician.
But also, let me ask you, why organization is different than A4M from IFM? Just there are even groups on Reddit, some in Europe, because you're in 50 countries. And around 400 doctors that are involved?
Yeah, correct. Yeah, it grew really, really fast in the past year. And I think the demand is not to have another institution or organization. I think the demand is to have a community. And so most doctors, when we met at different conferences everywhere, right? And conferences you've been to, you know how it is, right? There's like a lot of people. You don't know who you talk to. You're here to network and to learn. You want to see what is the latest cutting edge. And so what I realized, people, and especially doctors, we spend years, right? Sometimes decades, learning. And then when you practice, you're either in the OR every day, all day, right? You don't see anyone. Or you're seeing patient, right? And you can see patient up to 20 a day. And so it doesn't allow you anymore to connect with your peers. It doesn't allow you to share your experience, your knowledge, your even vision, and your challenges. And I can tell you, we have challenges every single day. And so I think the main difference with every other great organization that I highly respect is that I haven't seen a community so strong today than longevity docs, right? The generosity and the kindness in sharing and doctors like, Amy and Elizabeth and Robin that you had on your podcast are the first one to always share in a group, right? They're here to not only share the knowledge, but share as well, the questions and challenge each other, right? And so I think we created a place where it is now safe and aspirational for doctors to come and exchange on what is the future, what are the challenges, and how can they grow themselves by leveraging the power and the collective intelligence of the community. And so therefore, that's why I don't think we are a conference organization, or we are an education organization, or we are the community, and everything that's been developed from there. Because think about that. That was a WhatsApp group with 20 people to begin with.
Who were the initial people were in?
So I think Betsy was one of, Dr. Elizabeth Stewart was one of them for sure. Dr. Frank Lipman, I remember David Lipman, was one of the first in it. Giovanni Campanile, Dr. Kuo. We had so many friends, Amy Killen, Erika Klemperer. And so when they joined, they said, but you know what? We want to meet each other because we haven't met yet, right? Think about that. This is totally digital. So it's like dating digitally, but no one ever met in real life together. And so exactly a year ago, which was, I think, the 28th of April, 2014, we had our first event. And from there, people are saying, but we want to share more. We want to learn more. Wow. There's so many uncovered, discussion and topic. And obviously you have experts in a lot. And so people are so brilliant that they cover a lot of subject. But then all of a sudden you want to get deeper in cardiovascular, in hormones, in peptide, in the new technology, validated or not, right? And so that's where we believe that coming together was as well a necessity. Right? How do we recreate kind of this new kind of medical school atmosphere?
Obviously, I know a little bit from Dr. Yurt because constant contact with her. And when I asked her where she got her knowledge, obviously one of the places that she referred is your WhatsApp group. Because it seems like all these doctors around the world, it's like a pool of information that, a new supplement comes up. And one likes it, the other one doesn't like it. The other one says like, well, you know what? The research study shows it's great, but, I'm applying to my patient and it's not doing anything. So it seems like, it's not like, one person says something and everybody agrees with it. It seems like there might be sometimes butting heads. And, it's a good thing for us if we are the patient of these doctors because they're not just stuck with just one ideology.
You're totally right, and I think that's really healthy, right? There is no science without debate, right? There's no science without challenges. There's no science with data that hasn't changed in the past few years. So I think it is important to have those discussions, and you have the discussion in places where you feel that you're with the people that you trust. Right? People that have as well the same intention and the same way of sharing. And so, the WhatsApp group, I'm so grateful that Elizabeth said that. I think, coming from her, she's one of the greatest, is a really, kind compliment. And so I really appreciate that. But I think, this is where I get my knowledge. So if you look at it, this is not the WhatsApp group. Right? There's no longevity doc. The knowledge are coming from other doctors. The knowledge is coming from the generosity of doctors saying, I think I should share this information because I know someone else over there in this group is going to either challenge it or inform me of something I haven't discovered yet. Right? And so trusting that we don't know everything, we don't know anything, but collectively we have such an amazing intelligence that we should use for our patient.
My understanding also, because you're a tech entrepreneur and you have two very robust application for doctors to be able to use it for also obtaining these knowledge. Can you please talk about them a little bit? Because that might be really beneficial for whomever is listening, whether Turkish doctors who can speak English or, people from other countries who are interested to become a member. But I think you don't need to be a member of organization. You can join these applications to be able to follow the latest development.
Yeah, totally. So I think, during COVID, in 2021, it was really, my wife had COVID really early. And so it was really, challenging to find all the publication. And remember, nothing was really published. It was a lot of preprint. So I was spending days and days on PubMed trying to find the latest science. And so I partnered with a friend, Robin, and we started to build basically an engine, an AI, to summarize all those articles, but summarize it in a way that doctors can read it pretty fast in the morning and screen it and see if it was interesting or not. And so I think this is Juicy is really this app that leverage AI to summarize scientific publication and to deliver that in your during your breakfast. That's why it's called Juicy, the juice of science. It's like your nectar of knowledge. And so we have 200,000 healthcare provider using it right now across the globe. And so really proud of that growth. And on the other side, at the same time, we had a lot of demand. Hey, this is COVID. I wanna make sure I'm not sick. I want to make sure I prevent disease. And the vision was always to build, something to prevent, right? Some, organization or technology. And so, entrepreneur. First of all, I'm a physician, right? And so I look at the challenges for the patient and trying to build something that can serve them, but as well that can be replicated at scale and make it really much more affordable. And so when we started Hardy was kind of the compression like Juicy, heart longevity. It really was to focus on keeping people healthier longer. And so we did that with Dr. Frank Lipman. It was first of all, it started as a clinic, right? We were doing prevention. We were looking at functional medicine. We added devices and testing, and having those membership to support patient with the health. And then said all those data. Where does it go, right? We don't have a near electronic medical record. Where can we put all those data? Do we have a platform to do that? And at that time, there's no platform. So we had to build it. So again, I just try to solve issues and build technology on top of that. And so, Hardy now has obviously the technology, and I really want to focus that on the heart. I mean, still the first cause of death in the world. Could you imagine that? We're talking about cellular senescence and reprogramming, etc. But I'm excited about preventing heart disease. This is really something. I mean, first of all, this is something that is, this is my training. But I think there's something so powerful about protecting the heart, and there's a way to do it in a simple way, and that could be scalable and accessible.
So Hearty then it was a clinic. I didn't understand that before when I was
exactly. Look,
in New York?
As an entrepreneur, you have to pivot, right?
Sure.
First, you think about something, and then you realize, I mean, it worked really well. But what I realize is, how can we scale that, right? Is that just to rebuild a practice and make it better? No, it was a way to understand that if we want to practice this type of medicine, you need a platform. So yes, we started operating in New York, in New Jersey. So we had, different, Connecticut, different license. But again, you need doctors. And so that was the problem, Ezra. You know what was the problem? How do you find trained doctors? That's always the question, that gets asked. How do you find doctors that are trained exactly in preventing disease, in managing health? And it was hard. And so that's why I guess, longevity doc, was born in a way and took off, right? Because we wanted to have more doctors. And all of a sudden, it became another organization and company on its own and platform. And obviously, you have to always deliver what people want. And so I listen to the people, right? And so doctors wanted to have more doctors around them.
Yeah, what is the requirement? Let's say if there are Turkish doctors who speaks English, hopefully that they want to join. What are the requirements to be a member? Obviously, licensure for being a doctor, but any knowledge around functional medicine? Any knowledge about I don't know, regenerative medicine?
So first of all, you're right. You have to be a physician, right? A licensed and trained physician. We are totally independent on the specialty, So we have some surgeon, psychiatrist, ER, and people are already trained, right? And so you have two different categories. People are, doctors are already trained in functional medicine. They did some training in anti-aging medicine, few years ago, or in peptide, different type of training that . So they're more advanced, right? I would say. Some of them have as well clinics and practice that works really well, right? And so they're even more advanced. But then you have all the new generation, the generation that says, you know what, I heard about it. I listened to, amazing, podcast. I see the doctors talking about it. And I hear patient asking the question. So those type of doctors are now doctors transitioning from traditional health system, saying, I want to be educated. I want to know more about this. And we get a lot of doctors. So we have doctors coming from 50 countries. And so that's what I'm, mainly obviously North America, UK, Europe, even Singapore, Canada, but a lot of countries. Right? 50 countries is a lot. For me, I was like, I'm amazed. So every Tuesday, I meet every single doctor, Tuesday and Thursday. So I have a 15-minute talk. So that's the requirement, right? Is I want to meet people, I want to connect. That's the community. So it's not like you're clicking and then you get in, right? It is free to join. You have to be a doctor. You have to be passionate about helping people and extending probably health span for not only for your patient, but to be able to contribute to the community. So so I onboard people and I meet with them. I understand the challenges, what they want, what they need, and that's why we created, mostly the event, the certification, the decentralized research, because people are asking for it. So again, to summarize, you have to be an MD. It doesn't matter if the specialty, and it doesn't matter where you're from. What really matters is, do you want to practice good medicine? Are you excited about the future of healthcare? Do you want to share on the latest on longevity medicine? Are you open as well to be challenged? Are you open and willing to challenge each other in a companion way, right? To advance, I think the field.
Based on what I saw online about you, I think the organization, especially the Longevity Docs, is very recent, like a couple of years, 2 years, 3 years.
Well, look, the WhatsApp group is probably 2 years.
All right, that's great.
A year and a half.
So you have a chance to be able to look as a newcomer to the field, even though you're a seasoned doctor, but for this like longevity craze, you're a newcomer. Being involved with them. What are the practices that you see that, oh my God, this is so wrong, and you say like, we really need to erase this from the planet Earth?
Yeah, look, and so I think, I'm less radical. I tell you the truth. I'm less radical. I want to learn as much as possible about everything. And so sometimes, you see some practice, you say, wow, that's a little bit French, right? And so first of all, everything that is really, really expensive, and I'm not going to name things right away, but when it's really, really expensive and there is really, really little scientific or clinical data, that is really doubtful, right? So that's first of all. I think I want to see an alignment between the clinical outcome, right? Disease focus, and show me data, right? Either published data, right? Peer-reviewed published data, or even if you're a physician and you say, my protocol, my technology, my molecules work, show me your personal data that you published, even, on your website. I want to understand exactly what is your outcome. So I would say the ratio between outcome and pricing, the cost of those procedure. I think that's number one. Number two is everything that, is pushed by influencer marketing. Okay? And again, I have nothing against that. I just think that we have to be really cautious, us as physicians, into, either endorsing product or just, pushing and prescribing product because we've seen that somewhere else, right? So that's what I'm saying. I don't doubt it. I just do my research. And so what is good really with our community is now you can ask, what do you think about this test? And it's again all spectrum, right? I'm not talking about either IV, new therapy, large machinery, imaging or testing, or even wearables, right? It's across all spectrum. I think we have to have a critical thinking, right? And not only looking at who said that, is my patient pushing for it, right? And so my mindset is, okay, where did I learn from it? Okay, is it from a media, from a social media, or from a scientific publication? I think already the source of your information. 2, what is the business model behind it, right? As a physician, you want to understand what, is it someone who pushed it because it's affiliate marketing or communication, or is it because people really trust the product? Number 3, what is the cost ratio? If you tell me it is really expensive and I can do something else to improve your health span that's cheaper, then I would pick this one. So you can rank them. Obviously, what is the safety behind it, right? It could work, but not be safe, right? Do you want to take the risk? And last, I think, is the outcome and the compliance. Okay, show me the outcome, personalized outcome for you and me, right? Different background, different location, different lifestyle, different, generation. I think I want to see the personalized outcome. And so that's how I make the difference. That's how I choose, either to work or partner with this type of testing company technology. So I wouldn't push, when everyone is coming with a different type of IVs, right? I'm like, yeah, it could help on few things, but I don't think that's a miracle drug. When they say there is one drug, right, and I'm taking, whatever it is, I don't want to name names, but there is one drug, and that's the anti-aging drugs, and everyone talks about it, etc. It may have some benefit, but is it that strong in terms of outcome, right? So you want to look at that. Same for imaging technology. Everyone should do this scan because, right, we might find this, and that. Hey, you have to analyze the cost, risk, outcome ratio, right? So again, I'm not against everything. I am against the generalization and saying, yes, it has to be done, or this is the best, or this is a longevity intervention or longevity drugs. For now, I don't think there's any, right? And so promoting it this way is a little bit, I would say, not really ethical. So that's my position.
I really, really like how you describe. Then let me follow with this question from an end user standpoint. You guys can discuss in between, this is worth, plasmapheresis worth, not worth, gene therapy, yada, yada. There's so many stuff like, probably you're talking about all of them. Yes, when it comes to us as an end user, Dr. Yurt made fun of me saying, she said that, I call your approach to all these interventions biohackers syndrome. So you just jump into anything that is advertised. Thank God that I have her in my life so she can, stop me doing certain stuff. But are you helping also to the general audience that they will get a chance to validate their doctor's suggestion? Because that doctor may be in the longevity docs, because I kind of know most of them, but they contradict from one another because I know inside of them. So do you have any application, any software, any AI, anything that, me saying like, I'm suggested this, let me look into it?
Unfortunately, no. And I wish I could say, I wish I could say yes and no, right? I think, we still practice medicine in a personalized way, right? And so I think the number one thing you have to do to select your doctor, you know what it is? Trust. You have to trust your doctor, because I can tell you, a doctor is still, working, using the knowledge combined with the critical thinking and merge that together, right? So you take the data, the lab and the intervention or market, merging that together, and you say, Is that going to work for Israel?
Mhm.
How can we predict that today? I think in the future, AI is going to be, able to do that. But today we can't. And so I think that's why we need, obviously, more research. When I say research, we don't have any meta-analysis on almost anything related to, longevity intervention today. In the future, we may. So I think the best we have right now is N of 1, right? Use cases. Then you may have an expert consensus, right? And so I know, doctors who are listening understand the level of evidence, right? So how many doctors agree on that? So if you have one who say, yes, I love it and it's the best and that's going to work, it's probably a little bit different than having, 100 of them saying, yeah, we agree, right? 95%, this is something that we agree on. And I think the consensus is pretty strong, right? As a strong level of evidence and validation. Now, obviously, now you have to do more research and more data. The problem is no one is financing. I mean, it's not true, but it's hard to find funding for longevity research, right? Because, longevity research, like first, let's cure the disease. Now, let's try to extend, this period of time. So I don't think we have a tool right now. And so the tool will be get educated as an end user, right? Follow several doctors to understand. Use AI as well. I'm saying like everyone should use different type of artificial intelligence, right? Just to have a baseline of what are we talking about, right? This new molecules, this new testing. Let me get educated. It's almost free to do that as an end user. That's number one. Who are the leaders in the space? What do they say about it, right? From the most, I would say, innovative and cutting edge, taking risk, to the most conservative and traditional, say I'm against it, right? And I think the end user, most people are, are really now smart and educated and have access. Would say, okay, I have this baseline knowledge. I have 2 points of view, right? And based on that, I have to go back to my doctor that I trust, right? Again, baseline is trust. And I said, look, this is what I know about this. Now, try to tell me, is it good for me, yes or no, and why? And so that's what I would do as a patient, and I do that as well. And I ask the question: do you think if you say it's good, it's been published, but is it good for me, right? And so everything will be personalized in the future, powered by AI for sure. So it's going to be easier to understand what works or what doesn't.
You guys are getting big very fast, and soon enough, the name of longevity docs are going to be much more popular than anything, and therefore your members are going to have a different type of an advantage of promoting themselves. Can you vet for them? Can you vet for, me just going on your, I don't know if they can, do you have a directory that people can go on your website and say, hey, I'm living in this region, or I have this type of problem, and I kind of have a trust in these longevity doctors group. Let me see who's available, because there's a huge waiting list. I know that. But then, will you be able to be behind all these doctors that are registering or becoming a member and launching themselves as longevity doctors?
Yeah, no, look, that's a really good question. Are we endorsing them? If that's a question, right now we don't do that, right? Are we vetting them to join as member of the community? Yes. Does that mean that we assess the clinical skills right away to promote them? No. However, because of the demand, we started to create 100 hours longevity medicine certification, right? And what it means is we are looking at different way of understanding what is longevity medicine. So what is longevity medicine from the historical point of view? What is longevity medicine as the science of aging? How does that work? From the Yamanaka factor to inflammation, cellular senescence, etc. We have to understand that. And how do we now apply it to each organs, right? Each pathways. And so those modules are focused really on the science and the clinics. Now, the intervention, right? We have to look at different interventions. So the therapeutics intervention, the digital intervention, the more lifestyle intervention. We're going to train on that as well. And then something that I don't think any other certification or training is doing. how do you operate? How do you position yourself? What is your ethical responsibility and duty as a longevity physician? And so we are as well tackling the regulatory, the ethical, the growth, right? The communication of a doctor. It is really important to understand that now you have a different responsibility. People are coming to you with the hope, right? And even the option to extend those, this health bucket they have. So you have a responsibility, a high responsibility, right? It's not like you have a disease and you treat it, it works or it doesn't. Now, you say as a physician that you can help people stay healthier longer, right? So this responsibility, we cannot obviously be the caution of it, but what we can do is through this, certified longevity physicians, stamp, is say those doctors, wherever they have been trained, they took the certification for 100 hours, right? With assessment on each model and a final assessment and a peer group of doctors that have developed, the certification, 20 faculties to do that, with Q&As, with access to the network and the community. So therefore, at some point, someone in Turkey or in France or in the US could say, I'm looking for a physician. I probably want a physician that's, been through a certification that belongs to a community where they can have answer if they need that. Does that mean, they're good or not? I tell you how we're going to do that. We don't know. However, I think the power is the data. Like I said, you can claim anything you want. You have to bring the proof, right? And so the data is the scientific evidence and the outcome. And so what we realized really early on, it was Dr. Stephen Murphy told me that, a year ago, said, we have to have a patient registry, right? Where we show, the outcome and the progress of what we do as a group. And I tell you now, the flashback was like, as a heart surgeon, as a resident, we had patient registry, and I don't know, it's like, if you knew that, but every time you go out of the OR, you have to go into a computer.
Sure.
This is the procedure that's been done. Mortality, morbidity, how long did it last, etc. We had to do that. It was a compliance. And I think that it was invented by, Toby Cosgrove at the Cleveland Clinic. Again, the former CEO, but as well a cardiac surgeon, to say, hey, if we want to claim we're the best in the world, we have to prove it and we have to show others, right? And that's how the kind of registry started in cardiac surgery. So I think, can we do that now in longevity medicine? Saying, yeah, it's hard, but we have to be open to share data in the real world. What works, what doesn't, is not my advice that counts. It's the outcome of the patient.
I think there's a software needed, yeah? A common software at least that you can, because I know I worked in rehabilitation centers in the United States, and there is a system like that, from assistant counselor to the psychiatrist to the psychologist to whatnot, to even a lowest level of people who works there. They have a login that, not everyone can see every parts of the software, but you like step by step. I had like half-hour talk with the patient, and this, that, and the other we noticed, and then the other says we gave these medications, but the outcome was this kind of. That's what you're talking about. Then you can see what's going on, how your interventions, is it helping or not helping? What's changing? What do you need to change? That type of approach.
Exactly. And I think it should be transparent, but anonymized, right? And so longevity docs of the network can come and say, let me see, those intervention works or not. I've seen, 20 physicians prescribing it. This is the outcome, right? And it's not even now a physician consensus, it's real world data. And therefore, at some point, using those real world data to publish, right? Because a lot of people, they want protocols and they want guidelines. How do you do protocols and guideline if you don't know what works or not, right? I think it's overselling something that wasn't even validated. So I'm not pro guideline, to be honest. I think guideline is the whole way to look at it, right? We want to tell you how to practice. I think doctors are, I would say, educated enough, right? And then responsible enough to understand what they should do or not. But having the information to choose in between solution and way to practice, I think is the way to go in the future, right? And AI is going to change a lot of things, right? The power of AI plus the collective human intelligence that we have from all those doctors, it's going to bring a lot of wisdom, but as well a lot of cutting edge solution for the doctor joining. So you're right, it's growing pretty fast, and I see that in the future can become really something that is the platform to educate doctors and empower them to practice really really good medicine, and in an ethical way. And affordable way. This is really the dream.
Yeah, affordable is the key, because all these longevity doctors, functional medicine doctors, anyone who is focusing besides the allopathic medicine, that is much more expensive than a regular doctor's visit. And that's the complaint that actually I got, not me personally, but on my YouTube channel, when we have doctors that are suggesting, let's say, hormone use. And obviously we have great feedbacks, but then there are some people saying like, these interventions are so expensive. We don't even know how to reach out. The insurance doesn't pay. So I think the goal is to be able to make the price less heavy, let's say, for the end user. So I know that you recently had a very specific, very women-focused one-day conference in New York. I wish I was there. It was about hormones. What made you decide, you or your whomever is deciding, what made you guys decide to make such a specific one day just only about hormone training, I would say?
Yeah, so I think, look, I have a newsletter that I write every Sunday morning. So wake up, in the morning. This is like a ritual for the 45th time right now, right? And so I have kind of a sense of what people are discussing within the group. I see the news. I see obviously the investment, the new technology coming, and obviously hormones is everywhere, right? We're talking about not only menopause and women. That was really a hormone mastermind. So we talked about men as well, male hormones. And so what I realize is there's a really I think a focus on menopause, right? And that's obviously for the right reason. But hormones was really misunderstood in a way, right? We always thought, when you discuss about hormones, is prescribing hormones, right? And so not only I wanted for myself, right, to learn more, right, and obviously from pediatric cardiac surgeon to a hormone expert, there's a big gap. And so I mean, first of all, learning about hormones, what it is, what should you test, right? Should you prescribe or not? What kind of hormone should you prescribe for who? Right? Should you combine, and what are the risks? And so all those discussions that were happening in a fragmented way between, our meetups, our chat, our newsletter, etc. Why don't we have that in one day, right? Under one roof, with, doctors coming to educate. And so I asked, the friends of the group, hey, would you come to New York? And we took, 10, 11 faculty, it was 45 minutes each. And each one is a topic, right? And they were expert, right? And so we were learning from the expert. But the other in the room were asking the right question, debating it, etc. So we love to now get deeper, not only talking about the superficial philosophical, what is longevity medicine, what should we do, but can we go deeper in one day, right? And so what could be the next one? It could be cardiovascular, it could be brain, right? Why? Because of the demand from patient. And so it was never a strategy. When you say, why are you doing it? It's always listening to who's asking. And so what I realize is the patient are asking, because guess what? Every time you say, oh, what are you working on? I saw you were doing some longevity stuff. You go to a dinner, you know what happened? I'm sure you get the same. What do you think about A, B, C, D? By the end of the dinner, you talk about every single topic. And sometimes there's a topic you don't even know about.
Yeah.
So hormones came all the time. From, friends of my wife, friends of friends, other doctors. And so it came all the time because women and men were interested, right? And it's coming always, at a certain point of life. So I think that was really important to address that, to debunk some, not some myth, but some discussion, and make people comfortable to have those discussions. But I think there was like big topics, like I said, the heart and the brain, or I think really exciting, and we want to get deeper sometimes, because the doctors can come back and they can say, hey, you know what? I have kind of a playbook after 12 hours of listening to that. And we want it to be accessible to everyone and not, at the crazy cost. And so we recorded it.
Yeah.
And so now it's live stream, it's live. And the beauty of this is like, it's evergreen, right? Everyone can learn wherever they are in the world.
I bought the recording, but you guys need to do a little tweak on it because it's like a non-stop recording. You cannot you have to start and go all the way to the end to be able to figure out who's talking next.
Oh man, I know. It's coming.
All right, don't worry.
I promise you, it's coming, and then we're gonna improve the UX. But you're right. It's like that's what we wanted to offer it, and so we said, look, boom, we recorded, we do it, and hopefully you stayed until the 9th hour. But we're gonna make it more more accessible, more UX, different way to look at topics, etc. Work in progress.
So you're coming to Cannes. It's where you're born.
So I'm born probably 150 kilometers away from that.
From which direction? Saint-Tropez or Monaco?
The other one, Spain. On the other side, on the other side in a city called Nîmes, on the west. And so so Cannes is Cannes is kind of a love story. My dad landed in Cannes, or actually probably Nice, when the first time he came to France, and so he did his high school in Cannes and then became a doctor. So really full cycle. The first time I did a fundraising, a gala for the Heart Fund was in Cannes as well, and so Cannes is really dear to my heart. But what happened is someone reached out from the festival, the Palais des Festivals, where they do the film festival, and they said, we're really excited about longevity, and we're looking at the work you're doing, and we want to see if there is an opportunity to work together. So they came to our conference in New York. He says, that's incredible. Only doctors talking to doctors. Wow, that's being like in a really, really special club. Are you interested in doing a conference in Cannes? And so that's that's what sparked really the enthusiasm on making now longevity medicine this new star, and that's why we call it the new gods of medicine. Not in a ego trip way, but when you look at those gods, right? Hippocrates, right? Back in the days, can we live up to this promise, right? To deliver good medicine and bringing the latest cutting edge information in front of doctors. So yes, we're doing the Longevity Docs Cannes Summit in Cannes, end of June, and what a better time to be in the south of France and the French Riviera, but especially to bring 300 forward-thinking physicians and leaders in the space of longevity medicine. And like Elizabeth said, it is important to not only have the core, which is medicine, but as well the people that can enable, right? And who are the enabler, right? People like you, translating what we say behind closed doors to a large audience everywhere in the world, right? The investors, the policymakers, the government, right? So we have ministers of health coming. We have the directors of Aging Institute. We have obviously a physician practicing longevity medicine every day, but we have as well the innovator talking about gene therapy, like stem cell therapy, peptide, hormones. I think all those things that people are willing to learn about, understanding that it's really new, that we still need to have a debate around that, and bringing that on the red carpet of Cannes to make longevity medicine the new rock star in a way. And I have a lot of fun doing that with so many amazing, talented people. So
it's so interesting. When I was Googling you did an event. You didn't do the event, but you joined forces with Tarkan, our very famous Turkish singer. That? No, I was Googling. I was looking on YouTube, to be able to find things about you. And there was like a fundraising for your nonprofit organization. And I think at that time he was living in the United States.
Yeah, it was Kiss, right? The song.
Yeah,
Tarkan. Exactly. I mean, and look, that's where I always believed in the power of of communication, of the story, of making sure you connect with the people, right, everywhere in the world. And so Tarkan was like, yeah, I can support. I want to bring my voice to what you're doing. And again, we were like, I was 28, traveling the world, trying to raise a little bit of money to operate kids, and everything is just a journey, right? What is not really important is where you are, where you go, right? Is who do you share the journey with? And so I remember Tarkan like yesterday. This guy came and said, yes, I'm in. He didn't think twice. He didn't ask. He said, I'm seeing the work you're doing for kids.
Yeah.
Like, I'm touched. I want to support. And so he came, he's saying, so it's amazing that you remind me this, great memory, because it happened so many times with other people, lending their voice, their influence, their resources for the good. And I think that's what is needed as well in longevity medicine. That's what I see. I kind of relive the same feeling I had when I was building, organization, philanthropic organization. There's the same excitement, the same camaraderie, the same generosity around sharing what we know, because we know that's going to impact further than us, right? We're raising the tide. We're creating this network effect. Everyone's going to benefit from that. The patient first. So this is really exciting. It's good memories. Thank you for it.
You're very welcome. I think it's super important because, when Dr. Yurt said that you're a politician, obviously she didn't mean that you're running for the office, but I mean, you've been in Davos to you've been in Davos influencing countries. You've been in other investment circles to be able to tell people, hey, this is very important. You guys need to pay attention to this field. So the field needs people like you. I try to do the same thing for addiction field in Turkey. It's tough. You bump your head multiple times to the wall, but if you have the will, then you reach to a point and you become successful. So you're having before we're wrapping up, you're doing a physical challenge to yourself that I watch on Instagram before Cannes. That tells me that you're not just relying on longevity interventions, but you're really doing the basics, the important basic stuff. What would you put? Because not everyone, like we discussed, not everyone does have the money to be able to buy the supplements, see these doctors. What's your take? Do you think people need to do, let's start with the heart because you're a heart surgeon, to keep their heart healthy, then overall body?
Yeah, so I think let's start with maybe if you may, I want to start with something a little bit different.
Of course.
I think everyone should have a plan, right? And that's why I call it, you have a business plan, right? You're a businessman, you have a business plan. So you're an athlete, you have a strategy to train, right? You're a chef, you have a recipe. When it comes to your health, tell me, what plan do you have? Right? What is your roadmap? What is your business plan? I think it is really important for people, wherever you are in the world, right? Or even for doctors, wherever you practice, to develop a plan for your patient, right? And the plan has to be really simple. What works, what doesn't, what is expensive, what is cheap, what people can do, and what people are willing to do, and stick to it. And so I think this is the first step. So that's what I do for my challenge and myself personally. So I can deep dive into it. But I think having a plan where you can really follow up your objective, your goal, but as well the intervention. For me, I have cardiovascular risk, right? Running in my family, first of all, and I have high lipoprotein A, for instance. And as well, I'm a type A, I work all the time. I enjoy, traveling. I cook. I love food, right? I have a sweet tooth. I don't drink alcohol. I don't smoke. I don't take, recreational drugs. So I'm good on that side. But, I have as well some other risk, right? So first of all is getting rid of the risk. And getting rid of risk is pretty simple if you look at, the basics, right? And so I don't think we should go into the whole basics of, of lifestyle. I think, your audience knows, I think there's something people always, I think that's really underrated is good friends. When people say, what is the number one thing? I say, you should invest in good friends. Drop the other, flashy stuff. Who are your good friends? Tell me who exactly you can actually call, talk, ask advice for, love, and even can you roast, right? Can you be right? So roasting someone in confidence is good for your health. There's data around that, right? So I think good friends is one thing, free, okay? Optimism. I think optimism, there is a study that increased 7 years of healthy life for women. Optimism, free, right? There's no drugs right now that can claim adding 5 years to your life. And obviously, for me, personally, reducing stress, which is going to impact inflammation, is going to impact my heart health. Okay? So stress, you lived in New York, you know how it is, right? You never stop, you never sleep, everything is urgent. Can you take time to understand where are your stressors and work on them? So it's really strategic, right? I don't think there's a supplement that can help on that. Nothing against the supplement. But if you're stressed, you can take a list of supplement, right? Or you can take a list of drugs. It will help a little bit, but it wouldn't work on the stress itself, right? So understanding why there is like this highly stressful life that we live. What are we running after? Is it important? How does that impact our health? Are we trading health for something else? And I tell you, a lot of doctors are like that, right? We're trading, the health of our patient with our own health, right? We're trading the health of our patient with our quality of life, our family, the education of our kids, the time with our spouse and partner, right? The time to relax and reset, the time to learn. And so I think is seeing longevity as a whole more than just a biological system. Is the whole system of life that is basically getting impacted when you think about longevity, your environment, right? Your passions, your purpose. So now when it comes to the heart, it's really important to make sure that obviously, I'm sure, we can dig into cholesterol, but cholesterol and inflammation combined with stress is a ticking bomb, right? And so I think for that, you just want to make sure you have a heart healthy diet, right? Avoiding everything that is, too high in carbs, too high in saturated fat, fried, right? It's really easy to get, a burger here and there, some fries, some chips, that is really something I'm thinking every day. And it's not easy, right? And so I'm not getting into the diet. How do you reduce your inflammation? That's a cool question. Now, how do you know you have inflammation? You can test it. And so I think, again, don't want to get into the specific, but I think every doctor should look at advanced panel for the heart, right? Advanced lipid panel and inflammation panel, depending, the details, but at least a basic one is not really expensive. Based on that, understanding if there is already an impact, arteriosclerosis, right? The plaque in the carotid, in the artery of the heart doesn't happen, like this, right? It takes decades to evolve. How can we screen for that, right? Is there a way to understand it? Can we do an ultrasound of the carotid? Can we do a calcium score with a CT scan? Can we inject the CT scan to look at if there is any, occlusion or stenosis? Can we use AI even to see if there is a soft plaque? And based on that, you can have the intervention. So I think it's really understanding that there's one thing that's going to kill you, right? There's obviously a lot of different things happening. But one thing, what is this one thing? For me, I think it will be heart disease. So my number one focus should be to avoid that at all cost, right? One thing. For people, it will be something else. So I think it's understanding this. Now, the longevity challenge, I tell you why it is important. I think life is not linear, right? You cannot just go and be constant all the time, right? All the time, be perfect. Like, forget about that. Perfection doesn't exist in longevity. I think it's a cycle. It's a curve, right? So you oscillate between period of sprint, period of rest, period of being indulgent and, trying things, and then period of being perfect in your lifestyle. And so I like to do challenges, right? And maybe not everyone will agree, but I like to give me as well a period to say, by the way, I need to get back, right, into this really regimen lifestyle. And certainly in period where, I'm going to have high stress. Organizing the summit in the south of France is exactly in 63 days, right? And so figure it out, 63 days, I'm going to have to work every day to make that happen, all right? It's a lot of pressure. So at the same time, it's like, why don't I adapt my pressure and counterbalance it with a healthy lifestyle, some longevity rituals, right? And so I like those slow mornings. I went to do my hot yoga, 6:30 in the morning in New York. And again, it's not for everyone. Everyone can do it at your home with with a video. I do the push-ups, maintaining forces and balance, but as well calming my brain and just making sure I connect a lot with people. Like I said, good friends, people you can talk to, your team. It's so important. We're getting isolated more and more. Social media breaks the human relationship. So, what I did in the past 2 weeks? I blocked in my calendar a lunch from 12 to 1 p.m. I never did that before in 30 years, right? And so now I'm taking the time to connect with people deeper in a relationship, right? French like that, let's do a lunch, we're going to discuss this and that, but I think it is really healthy just to have a break. And people say, I'm too busy. It's a choice. It's organization, right? Is productivity, is deciding what you want to do or not. So, this is how I function. So those are the few tips, challenges, focusing on the things that can kill you, just making sure as well you have a great community of people, so underrated, and be optimistic. Everything's going to be fine. Anyway, we have no control about it.
These were great tips and guidance. Before closing the show, I want to just turn to my producer and thank him for his friendship, because when you were saying, we know each other for only 2 years, but we became such good friends, like-minded people. I see him like almost every day, but we can be rough to each other. We love each other. We forgive each other. It became an interesting relationship. So when you were saying this, and I can see him from the corner of my eyes, I just want to turn to him and thanking him. And thank you so much. These were such great guidance. I really, even for me, that I can apply. And I really am hoping to see you in France before New York. And we will add to the show notes everything about the longevity docs, your own website, and anything else that we should add, the Instagram account. And thank you for creating something so great. And hopefully I'll see you soon.
We see you really soon. Thank you to you. Thank you to your producer. You're producing an amazing platform for not only the doctors but as well the patient that they help. So thank you so much for your hard work. I had a great time talking to you, and I'm excited to see you really soon. Again, maybe we're starting the challenge until we see each other.